2 years after the World Health Organization declared an end to the COVID pandemic, Health Secretary Robert F. Kennedy Jr. is out with a new policy on the COVID vaccine. At his direction, the federal government is no longer recommending the vaccine for healthy children or for healthy pregnant women.
Until now, U.S. health officials had been urging COVID boosters for all Americans 6 months of age and older. But Kennedy said there is no clinical evidence to support giving healthy kids repeated booster shots.
This is a major change, of course, not only in policy, but in procedure for making policy, and it raises a lot of questions.
We will try to answer those questions with our Dr. Jon LaPook and Weijia Jiang at the White House. We'll begin with you, Weijia. Good evening.
Good evening. The CDC has an outside group of doctors, health officials, and scientists whose job is to offer guidance about vaccines. But Secretary Kennedy made this decision without their input and without a CDC director, a position that is currently vacant.
Health and Human Services Secretary Robert F. Kennedy Jr. made the announcement on X.
The COVID vaccine for healthy children and healthy pregnant women has been removed from the CDC recommended immunization schedule.
Typically, the CDC's Advisory Committee for Immunization Practices votes on changes to vaccine schedules and guidelines before the director of the CDC makes a final recommendation to the HHS secretary. In this case, the committee did not weigh in. Instead, flanking Kennedy today, the heads of the FDA and the NIH.
Last year, the Biden administration urged healthy children to get yet another COVID shot despite the lack of any clinical data to support the repeat booster strategy in children.
That ends today. It's common sense and it's good science.
There's no evidence healthy kids need it today, and most countries have stopped recommending it for children.
Until now, the government recommended COVID vaccinations for everyone 6 months and older. The CDC maintained the vaccine is safe for children and it prevented them from getting seriously sick. The agency also stressed vaccination is especially important for people at highest risk of severe COVID-19, including pregnant women. During his confirmation hearing, Kennedy promised not to change vaccine review standards from historical norms.
We're now one step closer to realizing President Trump's promise to make America healthy again.
Well, that CDC Advisory Committee was considering removing the COVID-19 vaccine recommendation for children. But one of the members said he was worried what message that would send because there are still thousands of COVID-related hospitalizations and deaths every year.
Okay, Weijia Jiang at the White House. Thank you.
Dr. Jon LaPook is here. John, remind us, go back to basics here. What is the relationship between pregnancy and a mother's ability to fight disease?
John, during pregnancy, the immune system of a pregnant woman is altered. And that's one reason why she doesn't reject the fetus as being foreign. But that alteration in her immune system also makes her more susceptible to infection, like with flu and COVID. And it's been shown that that increases the mother's complication rate and also increases the complication rate of the baby and the fetus.
Now, as Weijia just reported, John, this is a different way of doing things, but there are people who like this.
Yeah, I mean, this is different. The main thing that's different is that normally there's an advisory committee, and in fact, there's one scheduled for June next month. And the experts who meet, it's an open process, very transparent. The public can weigh in. They look at the pros and cons of the various questions. Then the advisory committee votes on it, and they take their recommendations. They send it to the CDC director. If the CDC director agrees, they send it on to HHS. Now, this announcement on X bypasses all that. So we reached out to HHS earlier this afternoon and we said, can you specifically explain to us the rationale behind no longer recommending the COVID vaccine in pregnant women? So far, we haven't heard anything back.
And quickly, if I'm a pregnant woman, I should do what on hearing this news?
I think you have to talk to your doctor about it.
Dr. Jon LaPook, we're glad we talked to you.